The United States of America has the most people incarcerated than any other country in the world. According to Aaron Burr from Statistica, there are 2.3 million people incarcerated right now. And with recidivism rates being so high, many of whom will stay in chains for the rest of their lives. I believe people who are addicted to substances should be given treatment and put through rehab rather than being put into our prison systems. Through popular shows such as Orange is the New Black and Wentworth, and popular movies such as The Shawshank Redemption and The Green Mile, we are given an in-depth look into the lives of these people and the daily conditions they face. While watching these shows and movies, you will see that there are definitely people who need to be incarcerated. However, will also be given a look into the people who don't necessarily deserve to be there, and that's who I would like to focus on today. I'm not sure why, but ever since I started watching the show Orange is the New Black, I have been completely fascinated with incarceration in the United States and the United States prison system, and why we have so many people incarcerated. So today I will be discussing why nonviolent drug offenders should be sent to rehab instead of prison, because recidivism rates are lower, it is more cost effective, and rehabilitation focuses on the re-entering of society as a productive member. First, I will speak about how recidivism rates are lower. Firstly, whenever drug offenders get sent to rehab, there is a lower recidivism rate. Whenever I say nonviolent drug offenders, I mean people caught by the police with drugs or paraphernalia, but weren't committing other crimes like robbery, assault, or murder. Drug offenders who do commit crimes. Firstly, whenever I say nonviolent drug offenders, I mean people caught by police with drugs or paraphernalia, but were not committing a crime alongside, such as assault, murder, or robbery. Drug offenders who do commit multiple crimes, like I mentioned previously, I believe should go to prison for a while to reflect on the pain they caused someone else, even if they weren't in the right mindset at the time. According to the Prison Policy Initiative, in 2017, one incarcerated person in 5 faced a drug charge. Of those people, 456,000 were held for a nonviolent drug offense, including possession. So if my plan to release nonviolent drug offenders to rehabilitation centers was enacted, at least 456,000 would be out of prison and rehab in about 30 days, considering everyone's plan to recovery is different. Recidivism is the repeating of undesirable habits that have negative consequences. The recidivism rate in America, according to Sheldon Stefago's journal, are quite high, with over 50% of prisoners released each year will return within 6 months to 2 years of release. According to the Federal Bureau of Prisons, people who emerge from addiction programs tend to avoid recidivism. As a country, we should put more emphasis on lowering recidivism rates for the betterment of our communities. So why are there lower recidivism rates whenever drug offenders go to rehab rather than prison? I credit this to the qualified staff and fully equipped medical equipment at rehab centers across the country. They have on staff all the time doctors, nurses, and social workers and caseworkers who can help you in any way possible. According to the American Public Health Association, only 11% of people who have been incarcerated for drug crimes have gotten treatment. That means that 88% of people in prison did not get treatment for their withdrawal symptoms and were not given a plan to enact their changes. At most facilities, there are daily therapy sessions where people learn how to cope with their problems rather than run to drugs when things get hard. Secondly, it is more cost efficient for drug offenders to be sent to rehab rather than prison. Since recidivism rates would be far lower if we use rehabilitation in the USA compared to prison, less people would return to prison. If less people were returning to prison, then there would be a surplus of money where the government could use those funds to fund rehab centers. The cost of one prisoner for 1 year in America is about $35,000. And when you recall how many people are in prison, that number really starts to add up. As more and more people would go through a 30-day rehab and work themselves to get away from their harmful habits, we would see less and less people going to prison for drug-related crimes. If rehab is cost-effective, then why don't we enact the change now and start saving money? Recently in America, you hear the term for-profit prisons. And not many people understand what this means. And I believe if more people knew what this meant, there would be more and more outpour for a change. For-profit prisons in our country are run on money that the state has given them, and they cut costs by any means necessary so that they can make the most profit for themselves. These privatized prisons are only in it for the money, while federally funded prisons have a goal of keeping prisoners out. If for-profit prisons were eradicated, I believe we would see more of a push for rehabilitation programs in government, but for-profit prisons, lobbyists shut down talks of any legislation being on the table before it can be fully realized. Rehabilitation at first seems like it is very expensive. When we hear about celebrities such as Demi Lovato or Lindsay Lohan going to these luxurious rehab centers and think that must be expensive. However, most centers are actually quite cost effective. When you look at how long people are in rehab for compared to prison, the difference is staggering, with some drug charges lasting up to a year and most rehab programs lasting up to 30 days. That's an 11-month difference, and you can compare the cost of a prisoner per day compared to the cost of a rehab patient per day. While prices for rehabs vary, there are programs across the country that are free or have a very low cost. But if you are well off enough to pay for these luxury rehabilitation centers, that is your prerogative. Finally, rehabilitation focuses on treatment and the re-entering of society. This is a more humane solution to incarceration. As seen in popular TV shows and movies depicting what prison life is actually like, you are shown horrors and atrocities that make us revolt and think this shouldn't be allowed to happen. Rehab centers know how to treat patients who are dealing with various withdrawal symptoms and get on the right medications that they need to survive. If you had to put yourself in their shoes, would you rather be put into prison than given help that you needed? You can get a job a lot easier if you've been to rehab compared to prison as well. Whenever you have convicted a felony, you are legally required to tell your employer that you are a felon. And most times that reduces your chances of securing a stable, high-paying job. Since it is easier to return to dealing drugs, getting a job with good benefits and pay, many times drug abusers will return to their old lifestyles. Even though, according to Oxford Treatment Center, a relapse is likely to occur if you have faced a drug problem, in rehab they work so relapses are less likely to occur, which given the correct treatment, your probability of relapsing decreases. In rehab, you work on yourself and how not to get back to your old habits. In prisons across the country, contraband comes in every day. While it is harder to find research on this, it is likely that drugs could be within the prison and accessible to recovering drug addicts who need time to detox. According to Edelman, rehabilitation focuses on treatment and the re-entering of society as a productive member. This is a more humane solution to incarceration, in my opinion. As seen in popular TV shows and movies depicting what prison life is actually like, you are shown horrors and atrocities that would make us revolt and think this should not happen to any person. I remember one episode of Orange is the New Black. The main character, Piper, gets brandished with the Nazi symbol because she is stealing profits from the other prisoner inmates. While she shouldn't have been stealing profits from these other inmates, I believe that no human being should be brandished like a cow. Rehabilitation centers know how to treat their patients dealing with various withdrawal symptoms, considering withdrawal symptoms are very different when compared to withdrawal symptoms of meth and withdrawal symptoms of heroin and crack, etc., etc. They need to get on their right medications that can be prescribed by the fully trained staff at the rehabilitation centers, or they can be put on medications that obliterate the addiction altogether. If you had to put yourself in these people's shoes, wouldn't you rather be given help than locked up in jail and being told, sorry? You can get a job a lot easier whenever you've gone to rehab rather than prison as well. Whenever you have been convicted of a felony, you are legally required to tell your potential employer. And most times that reduces your chances of getting a stable, high-paying job. Since it is easier to return to dealing drugs, getting a job with good benefits and pay, many times drug abusers will return to their old habits, which is exactly what rehab focuses on combating and dealing with. Even though, according to Oxford Treatment Center, a relapse is likely to occur if you have faced a drug problem, in rehab they work so relapses are less likely to occur, which when given the correct treatment, your probability of relapsing decreases. In rehab, you work on yourself and how not to get back into your old drug habits. In prisons across the country, contraband comes in every day. While it is harder to find research on this, it is likely that drugs come into the prison each day as well. And with drugs being in the same premises as people who are trying to get off of these illicit substances, it can be quite dangerous, and their relapse could be so intense that they could die. According to Edmund Benson with the American Psychological Association, researchers have also found that pessimistic nothing works attitude towards rehabilitation that helped justify punitive prison policies in the 1970s was overstated. When properly implemented, work programs, education, and psychotherapy can ease prisoners' transition to the free world. If we dissect this quote, she's basically saying that in the 1970s, crime is bad, they need to be punished, was all the rage, and instead of looking at these people and trying to help them, they focus more on the punishment aspect, while the programs that were instilled to help prisoners develop their life and make these changes were pushed aside. There are also many trained social workers and caseworkers who will help work with you closely to help you get back on your feet and find a job after rehab. So, the choice is clear. Nonviolent drug offenders should be sent to rehab rather than prison because recidivism rates are lower when they are sent to rehab. It is more cost efficient to send drug addicts to rehab, and rehabilitation focuses on the treatment and the reentering of society as a productive member. As the next generation of citizens to make an impact on our great nation, we have to right the wrongs of the past, like including rehabilitation as an alternative to incarceration. So call your senators and representatives today and let them know that you stand with rehabilitation. Thank you.